No need to say fetal well-being assessment is neither crucial but also critical. We can assess it clinically, biochemically, and last but not the least, biophysically. The clinical assessment is useful as a screening test for further investigations. Due to poor predictive value, biochemical test has been abandoned and replaced by biophysical evaluation. Biophysical evaluation is evaluation of biophysical activity. For fetal well-being assessment, biophysical activity obviously valid and best method. Biophysical activities initiated, modulated and regulated through fetal nervous system. All of us know. Actually, we have to know and we have to focus mother and baby intactness and insufficiency of uteroplacental circulation, lack of which somewhere may be cause of fetal hypoxia, which in turn causes metabolic acidosis and CNS depression. And any CNS element affect biophysical activity. In this way, assessment of fetal well-being and absence of uteroplacental insufficiency can be done through biophysical activity and biophysical evaluation. Biophysical activity tests are fetal movement count, non-stress test, cardiotocography, and ultrasonography. Fetal movement count is simplest biophysical evaluation, and loss of fetal movement is commonly followed by disappearance of fetal heart rate within next 24 hours. Loss of fetal movement is assessed by daily fetal movement count. If there is diminution of number of kicks to less than 10 in 12 hours, it indicates failing placental function, which leads to fetal hypoxia, acidosis, and depressed CNS function. If results of these methods are ominous, fetal well-being is assessed by non-stress test. Non-stress test is without giving any stress to mother and fetus, which is contrast of stress test, that is also known as oxytocin challenge test. In non-stress test, continuous electronic monitoring of the fetal heart rate along with the fetal movement is undertaken. Observed association of fetal heart rate accelerations with fetal movements indicate a healthy fetus. Here, healthy fetus means fetus is not in jeopardy rather than predicting continuing fetal health. Non-stress test is named as reactive and non-reactive. Reactive indicates fetal movement can accelerate fetal heart rate and in turn indicating normal CNS function, absence of acidosis and absence of hypoxia, up to the insufficient uteroplacental circulation, which is to be focused for fetal well-being. When two or more accelerations of more than 15 beats per minute above the baseline and longer than 15 seconds in duration are present in 10 to 20 minutes observations, it is known as reactive non-stress test. Absence of the two accelerations in two observation period is non-reactive. Multiple variable assessment of fetal biophysical activities is more sensitive and reliable test for fetal well-being than the single parameter. This biophysical profile of multiple variable is known as Manning. This Manning profile is made up of 5 components. These are: number 1, a reactive non-stress test. Number 2, presence of at least one episode of fetal breathing movement within 30 minutes and lasting for 30 seconds or more. Number 3, presence of at least 3 discrete gross fetal movements within a 30-minute period. Number 4, presence of fetal tone, which is defined as one or more episodes of limb extension with return to flexion within 30 minutes. Number 5, adequate amniotic fluid volume evidenced by one or more large pockets of fluid greater than 1 centimeter in vertical diameter. Apart from the standard non-stress test, these 4 parameters are observed by using real-time ultrasonography. Since oligohydramnios affect fetal movement and consequently other observations, so in the absence of oligohydramnios, a score of 8 or 10 is normal, a score of 6 is equivocal, and a score of 4 or less is abnormal. This score is given for biophysical profile named Manning, and that's why known as Manning score. These scores are calculated and estimated on the basis of a standard decided. This standard is: a normal observation is given a score of 2 and an abnormal one is given a score of 0. Fetal cardiotocography is also one of the biophysical assessment method. If we assess fetal well-being by it, suppose after 30